Hello, assalamu alaikum, good morning, khush aamdeed, ji ayanu, goeiemorgen, ishpata.
Bakhair Agale, Ni Hao, Junashumme, Washmale, Ohio, Genzaimus, Guten Morgen, Ola, Boyor, Privie, Kaifahal, Hale Shabbat Shatore, Ahlan Vasalan Marhaba, Buna, Mucho, Gracias, Swabia, Bali Keraya. And thank you very much, ladies and gentlemen, for tuning into PDB World. You're watching World this morning along the very fantastic, the very amazing, the very superb, the very intelligent, the very intellectful. Ladies and gentlemen, she happens to be Miss Shiza Hashmi, and I happen to be Shahzad Hassan Khan. And hey, guess what? It's Friday today.
It is.
Hi Shiza, how are you doing today?
I'm doing great, thank you so much for asking. And I love the declaration of Friday, especially when you wear it on your shirt.
I don't know whether people can read it or not because I think that the aperture is too high. But yeah, there's Friday written on my shirt. And that's the exact reason why I'm not wearing a waistcoat today. Because
Just
I wanted
to
people to see it as well. And we know for sure, because I've been on television for so long, that that white or probably the lighter colors won't look good.
quite
But
show.
since it was Friday, I was like, just catch a vibe, people, and we hope that you're actually ready to kickstart your day with us as well. How are you?
I'm great. Yes, you did already ask that. But speaking of Friday, I
Just
feel like
excited.
we're always so excited for the weekend because, well, our kind of job is a daily thing.
Are
and
you
it
today?
happens for the weekend?
Yeah.
Why not though?
Because we're working tomorrow as well.
Oh no, I forgot. Okay, well, that's on another note.
Yeah.
But I really hope all of you going into the weekend with high spirits actually have an amazing weekend ahead.
Exactly.
All of you who have plans with your family, have a great time. And all of you who even don't or have any plans, well, for solo as well, I request you all to please still follow the SOPs when you're going out, because I feel like it's because of you guys swimming pools are now closed, Shazad. Imagine that. I mean, unfortunately, we are going towards a lockdown. It is not declared yet, but we might be hearing it soon.
True.
So let's try to control that, please.
Exactly. I mean, I think everybody kind of really needs to take an initiative towards making sure that each and every family member of theirs is actually following all the standard operating procedures. And it's not that hard to do that because we know that we'll be saving a lot of lives, ladies and gentlemen. So let's do it together. But other than that, since it's a Friday and it's a great day over here in Islamabad, the weather's changing.
Yes.
Now, I actually used to offer my Maghrib somewhere around 7:05 and 7:10. Now it's at 6:38. And, it's kind of getting very convenient because, you get done with Asr and then all of a sudden, hey, it's Maghrib time as well. So you really do not have to rush or run for the ablution once again as well. But other than that, ladies and gentlemen, today on a Friday, credit's due where it's due because a lot of people were talking about the people who were heading the Olympics committee as well. Imagine that, okay, unfortunately, we were not able to bring in a gold medal in the Olympics. But hey,
So what?
guess what? We got a gold medal in Paralympics as well.
Wow.
And who did that? Ladies and gentlemen, we're very lucky, in fact, that he's the first ever Pakistani to win a gold medal in F37, which happens to be the category in discus throw with a 55.26 meters. Haider Ali, ladies and gentlemen, for Pakistan creates history to win the first ever gold medal in Paralympics.
Well, previously he had won a silver in 2008 and also a bronze in 2016 in long jump category. But now it's the gold for Pakistan. Congratulations, Haider Ali. Congratulations, Pakistan. We are so really proud of you.
Super proud of you, Heather. You've done it. You've outdone everybody else as well. And you are our hero. You are our champion. And not just that, just yesterday I was actually reading this news as well. The Chief of Army Staff was actually in a meeting with all of those people who are athletes who participated in the Olympics.
Wow.
And kind of talked about everything they needed as well. Wow, that's wonderful as well.
That is absolutely super because we do, keep discussing how we need to pay attention to, especially our athletes, if we expect them to bring good name to Pakistan.
Exactly. But I actually have a question for you, Shiza, today. What gives you happiness? That's one question which I wanted to ask you because just a few days ago, I was in conversation with Mr. Shoaib Akhtar, one of, in fact, the only fastest ever bowler who's actually stepped on this planet as well. And we were having dinner. So he asked me, okay, what makes you happy? And what makes you thank Allah Almighty? So I will obviously share my answer, but what's your answer?
Well, it's just a sudden question. I feel like happiness is abstract. I want to say that, different things make people happy. Well, I will definitely think about it. I want to hear yours first.
All right. So, obviously he was referring to the kind of food we were having and, how people will be so thankful of having all of those ribs and mutton and malai kebab and malai boti and whatnot. But my answer was very different. I was like, Shoaib bhai, for me, the reason of my happiness and why I would always thank Allah Almighty is my baby girls.
MashaAllah.
And it's because of the fact that I every day, whenever I get free from work, I look forward to going back home and kind of playing and chasing them and running behind them as well, where they say let's play daddy, let's play hide and seek. And I'm like, okay, let's do. So, the little one, she does not even know the counting. So she's like 1, 2, 3, 4, A, B, C, B, and something like that. And, she starts running.
Is she in her peekaboo age?
Yeah, she's in her peekaboo age as well. And this is one thing, ladies and gentlemen, where all of a sudden, while I was saying it, I thought that, imagine that there are people who are still trying to have babies, but unfortunately cannot have. And they are actually away from that blessing of Allah Almighty. But why are they away from that blessing when we have actually so many technological interventions? This is something, Shiza, which we will be talking about.
Right, but one thing.
Yeah, go ahead.
All right, so when we talk about such people, of course, we have to sort of clarify one thing over here. There are definitely couples who, by choice, do not want to have this in their life. That is totally all right. As long as you're deciding for yourself, it's totally fine.
I mean, they have dogs and cats, that's
for
what they do.
For sure, no question in that, whatever you want for yourself. But those who have been trying for so long and unable to still conceive or still, create a family of their own, there may be so many different reasons for that. 22% of Pakistanis actually do face one or another form of infertility. So this is what we are talking about. But before I do give anything else away, we actually have one of our brilliant reporters. She went to a place to film something.
To a very brilliant doctor as well.
Yeah, she filmed something for you guys, just for you to understand. Let's take a look at it, and when we come back, we're going to discuss it in detail.
We have a legend over here in the studios with us, ladies and gentlemen. People call him Doctor. Let's see who he is.
Let's do it.
Currently, we are at American Fertility Center along with Dr. Rizwan Malik. He is well-known IVF and infertility specialist, and now we are going to see that how he conducts the surgery. Furthermore, we will ask him about his expertise and what kind of facilities are available here at American Fertility Center.
American Fertility Centers, we have the most advanced surgical team and the operative facilities. We provide minimally invasive surgical options, including advanced laparoscopic techniques. जिसमें हर तरह की ovarian cyst or any bleeding problems can be handled and addressed. Any fertility surgical issues, that they were able to handle them and provide जो fertility की treatment है. Also, we treat our patients with bleeding issues. We are the only facility in Pakistan who is able to provide endometrial global ablation option. We're very proud that we're able to offer that as alternative hysterectomy to women in our country. So this is most advanced surgical units in the country with all facilities and all ability to do any surgical procedure. We have special expertise in minimally invasive laparoscopic and hysteroscopic procedures. We have robotic experience. In the United States, we do a lot of robotic work, difficult laparoscopic cases, and minimally invasive surgeries through the robot.
All right, ladies and gentlemen, since we are talking about minimal invasive surgeries, the alternate name, it's also known as keyhole surgeries as well. But obviously, the experts over here in the studios with us, he happens to be an IVF expert. He is a robotic surgeon, and he is Dr. Rizwan Malik. Hello, assalamu alaikum, good morning.
Hello, assalamu alaikum. It's good to be here again and being with you guys. It's a pleasure.
Thank you very much. Thank you very much for joining us. It's wonderful to have you, and it's wonderful to know that you're giving happiness to a lot of people and increasing the population day by day.
Inshallah, I'd like to say TGIF. So thanks God, it's Friday and we're here. Weather is nice. I'm really enjoying my stay in Islamabad.
MashaAllah, and
Pleasure.
it's wonderful. It's wonderful.
Well,
and
that
so,
is definitely...
to get the conversation started, do you want to kind of take the lead?
Yeah, I
Okay,
want to. So I think let's begin with the basics and try
Yes.
to understand why and where the issue lies.
Yep.
So when we talk about infertility, sir, I want you to explain what it is, what counts as infertility, and how prevalent is it in Pakistan?
Gee, infertility is when a couple lives together for after getting married for 1 year under the age of 35 and 6 months after the age of 35, and they're unable to achieve a pregnancy, that's when we feel that the couple should seek expert care. Or it's about, I think we're having a conversation that a lot of times couple come and see us after 20 and 25 years, and now they've reached either an age or some sort of limitation where they are kind of, it's more difficult for them.
All right.
So I think that's the message, one of the messages we need to kind of put out, that everybody has a different specialty. And an eye doctor is, kind of for eyes.
Yeah.
A mechanic is to fix the car. So really seek a center that is specializes in fertility. So that's where I think we have established a center, American Fertility Center, just focused on this specific one cause, that we want to bring the best care for the couples who are having difficulty from the beginning to the end. It may be just 6 months of marriage, hey, let's can get seek. We need some medical therapy, to somebody who's been trying for 20 years and failed 5 places, and say, listen, hey, what can I do? What are the advanced techniques to help me succeed?
True. Well, and that's wonderful. Thank you very much for bringing that technology down to Pakistan as well. And we're sure that, you're obviously doing a work where people will definitely give you a lot of prayers, and then they get happy as well, which is wonderful. Because over here in Pakistan, we seriously do not think about not having babies. I think most of
It's
the
a
time,
given.
whenever somebody's getting married, the first thing anybody would ask them is, "Bacha kab ho raha hai, yaar?" So things like that. That's the kind of society we live in. But other than that, sir, since you've described infertility itself, and there are latest technologies which are coming in. There's technological intervention in it as well. You happen to be a robotic surgeon yourself. What are the treatments available? And before you answer that, because we have gone through this kind of conversation, ladies and gentlemen, before, I think it's always kind of recommended for men to get themselves tested first, rather than, because we have a kind of stigma attached to it as well, where they start blaming the women in the first place. And then I want you to kind of speak about it. In what percentage of cases do you think that it's the women or the men?
Right. Especially that, I think one of the things, since we're talking about some philosophy today, and kind of bringing a message out there, and some of our conversation before the show, I think one of the things that we can communicate to the listeners is, again, you use the word stigma, right? So we are the ones who create the stigma. True. It's not somebody else. It's you, it's me, it's Shiza. So really, we are the people. So one of the things that really, it just came to my mind when I was, we were talking, that, listen, why cannot we change the world, right? If you're talking about creating peace, such bigger things, we are all talking about peace.
Well, what can we possibly replace stigma with?
One of the things, that message I would like to create is really that for each one of us to change and say, listen, we're not going to go ask that couple, just like you said, hey, listen, hey, the pressure, let's change the pressure. Let's all, beyond the couples who are trying to have a baby, it's a message for everybody who's watching the show to listen, hey, next time you're faced with that couple, or your son, your nephew, your niece, leave them alone to a certain point, or give them the privacy.
True.
So kind of one of the, I think the highlights, or the thing that struck me the most was really a patient, and a friend who came, and he said that, Rizwan, when I go, he's a senior officer, so he goes, listen, when I get posted to a new station, even the gatekeeper, he comes up and says, listen, sir, do you have children? And if he says, no, I don't. And then, he said, listen, let me give you this telephone number to Hakeem, or, hey, if you go pray these prayers, then it will happen, or all that. And that is what hurts the most. Listen, I'm a highly educated person. I know I've been through this. I've been through physicians. I know what it is, and I know what the hurdles are, and I'm trying to get through those hurdles. While I get through those hurdles, it is this what hurts the most, and what makes the journey tougher. And really, and that stuck with me for for the rest of my life. I give that example in the United States when I go, talk to my patients there, and I kind of walk through that walk. So, kind of, I think one of the pledge to our it's a culture. Culture doesn't, when you talk about culture, culture can be changed. The change comes from you guys. You guys are, are the ones who lead the culture, who kind of talk, people look up to you, younger generations. So those are the ones who can change that culture to say, listen, hey, next time I see somebody, I'm not going to say that. It's something that, or if I say it, hey, I remember that conversation for that morning show, just like I remember that conversation with this friend of mine, for about 4 years ago.
Yeah.
That's I don't ask, I don't get as a physician, the people come, but as I think the pledge is that when you do that, remember that this conversation, and say, listen, hey, be sensitive. I think is the message, and don't give the taweez or I know you're trying to do the right
And
thing
just
or the
don't
good
give.
thing.
You're just trying to help, but
or
yeah.
you're trying to help.
But it's going to
I
hurt
get
them.
it,
Yeah.
but if that help hurts somebody,
What's the point?
well, why? I mean, these are extremely intelligent individuals, highly educated, and that's how they achieve those big, achievements in life.
Exactly.
So when you say, listen, hey, or do it in a different way, I think let's all find out a way that doesn't hurt people.
And that's great. And sir,
Definitely.
I mean, it's the other way around as well. But I have an incident to share. Well, in fact, it's it's by Prophet Muhammad sallallahu alaihi wasallam as well. So once Prophet Muhammad sallallahu alaihi wasallam was sitting in a playground, and there were a lot of children, and they were playing together. So there was this Sahaba who came up to his place, and he was like, "Where's my son?" And the wife, or probably whoever, told that, "Hey, you know what? Your son's actually playing in the park with the children." So he went up to the park, and he saw Prophet Muhammad sallallahu alaihi wasallam sitting over there, asked for his permission, "Can I take my son back?" And he said no. Second time he asked for the permission, he said no. Third time he said, "Okay, yes, but please make sure that you do not call him by his name or by saying, 'Bete, come over here.' Just say or call out his name so that the other orphan children do not feel that, okay, if we would have had a father,
Right.
how bad or, how worse they could have felt about it as well." So I think
How
that we take
beautiful that
examples
is.
from that as well.
Definitely, and that's so beautiful and sensitive as well. But like Dr. Saab mentioned, I think I'm going to take that just a moment to sort of further the narrative of how our culture is sort of toxic in this term. I feel like it's become a matter of small talk.
Exactly.
People will just get together, and well, even people from your own family, and just for the sake of talking to you, just for the sake of developing a conversation, their questions are going to be directed about when you're going to have a family, when is your first kid arriving, when are you going to, and even in office spaces, when are you going to take your days off for your maternity leave?
Yeah,
Whenever
imagine.
I want to, you guys. I mean, it's not definitely not a small talk for you.
Right.
But now
I
coming
think
to
as our culture kind of evolves and the education comes in, and that's what we see in the U.S. Just I mean, it's personal life, and also I think having that personal space to say. I mean, sometimes
Exactly.
strange.
Sir,
Somebody
majority of
just-
the time, I think it's family pressure as well. I've
Right, sure.
known a couple of my friends where initially they weren't, they were trying, but they were not able to, God forbid, as well. And then now, finally, alhamdulillah, they are having a baby, so they're very happy. So their stress and anxiety will come down to that.
yeah. Okay.
But we do come across these couples where, for the first 5 years of marriage, or 6 years, or 10 years of marriage, they're not having a baby, and all of a sudden they have a baby. So I think that we should refer to them as subfertile. I mean, if there are subfertile couples, how do you treat them?
So it is kind of so about after a year, it's the couples that are kind of living together. We expect 85% of the couples to achieve a pregnancy. If that does not happen, that's where we define infertility. 15% of the population. And it doesn't mean you cannot have a child, right? So like subfertile or some truly infertile, which somebody cannot have a child, is very, very small percent, less than 1%.
Right.
So most of it really, truly is something very minor, but kind of where you bring up the issue of the 5 years, 6 years, 7 years, and I think that's where the gap is in our. What I've seen, at least in practice in Pakistan, is that people are kind of either going to the specialty orthopedic surgeon saying, "Listen, hey, they're
Right.
treating infertility.
Yeah.
Man, I don't want to fix any bones. I got no clue,
well,
and I
going
don't
to
want to do it." So
orthopedic for infertility?
infertility. So that was like, I mean, came up and.
What did the
orthopedic-
doctor say then?
Well, doctor said they wrote a few things that were kind of. I think it was.
Was the doctor being honest that, hey, you know what, you came to the wrong doctor?
No, not really. Yeah, yes and no. I mean, it's funny, but they wrote some common sense things. Go have sex or other things, or take this vitamins or take this,
Yeah.
which are common things. Take some vitamins and go. But then it delayed their, their journey.
Yeah.
It delayed the journey. I think that's where the gap is. That they're in their place. They're doing the best thing they can. They're specialists in orthopedics. They fix bones. They fix what they do. And so the person is sitting there and instead of getting like to go to somebody else, they're like, here's a bunch of vitamins, go take. And then that person didn't get the message. I need to go find a specialty center. That's where I think the time gets spent and wasted, and there's delay in the care, and that also it involves then emotional burden that is there with it. So we have lots of, for the couples that are having difficulty, we start with diagnostic procedures. We start out with checking the fallopian tubes to see that they're patent. In Pakistan, what I've seen is unique. Is really in the United States, we see a lot of infections, sexually transmitted diseases and all that. Up here, damaging the tubes. In Pakistan, it's endometriosis, very common and it has caused a lot of damage. It's not caught early and treated early, and surgically it's not repaired. So what happens over time, it accumulates the damage, and it causes the damage to a point where it now is overwhelming for that
Doctor,
body.
so just to make it clear, is endometriosis a part of PCOS or is it something entirely different?
Right, so it is two different diseases. So PCOS is polycystic ovarian syndrome, where the ovaries cannot make mature eggs.
Okay.
So eggs are present, but they don't get mature and they are not available for fertilization.
Okay.
Endometriosis is where the lining of the uterus that comes out with menstrual cycles every month, that kind of gets backed up in the stomach, stomach meaning pelvis, and inside the body, and the immune system normally cleans it out. In these patients or in these women, that process is not so efficient. So as these cells take roots and start to bleed and grow inside, then over time there's so much inflammation, so much damage in that pelvis that it causes interruption of the egg production, egg release, and embryo implantation, all are affected. So these are things that need to be caught early. I get sometimes, so more educated families, sometimes in Islamabad, they bring in teenage daughters to say, listen, hey, she's having severe menstrual pains or issues. So that's the time to get hold of those health issues.
All right.
Or somebody who is, so really we don't just deal with infertility, it's just a lot of gynecological care and preventative care, from early on to somebody's 21. So I get a lot of young ladies from Kuwait, other places coming in that, listen, hey, we are kind of having problems like severe pain with menstrual cycles, irregular menses. So they come to us. This is now
So these are early
care,
symptoms, right?
Early symptoms that you got to address them at that point. They're not married. They're not trying to have kids.
Yeah.
But then if you put that fire out early, you'll prevent those consequences down the road.
Yeah.
And that kind of also brings me this last batch we did, we had referrals from oncologists where they said that, last time it was kind of a young lady who was diagnosed with leukemia, this time breast cancer. These young ladies, 28 years old, who are having these cancers. So then they're referred to us. They don't have children. And so what we do is we take their eggs or ovarian tissue, we freeze it.
Yeah.
Oh, wow.
And then when they're done with the chemotherapy, but after chemotherapy, their own eggs are damaged from chemotherapy.
So do we have this technology over here in Pakistan?
Yes, we do. We are the only center.
Because I went through it myself as well, and that's the first thing which the doctor said, that if you want to complete your family, you probably need to get your eggs frozen as well.
Your
I think,
sperms,
Yeah. I think it's great. Yeah. But adding on to that, sir, since we are talking about polycystic ovaries as well, referring back to it, because we're very short on time, and you've spoken about it, that we really need to be careful about the early symptoms as well.
Right.
So what are the modalities of the treatments over here in Pakistan? Can you compare it with each other?
Sure. So diagnostic work is initially very important. Understanding the pathology, pathophysiology is important. That's why I feel coming to a specialty center for treatment-wise, we have in vitro fertilization, we have medical therapy, we have surgical therapy. So that's where I think you saw some of our surgical techniques and operating rooms where we have some of the best equipment. And I think with the equipment comes the tools are there, but if you don't, the man behind the tools is more important. Somebody can
Absolutely.
use the tools and give you the right treatment. That's why we feel that, by being trained in the United States, having medical education from the United States, gave me the tool, gave us, the extra edge to provide that care where we can do a lot of it laparoscopically, and also then with IVF lab, we have one of the best IVF labs in Asia. All of our team comes from abroad. We come in, we all get together, and we're here for 2 weeks. During those 2 weeks, we collect the eggs, we make the embryos, and then either freeze the embryos or put them back into the uterus. And we have treated some of the couples who have not had success at many centers over multiple cycles, and then they got pregnant in our hands with God Mighty's help.
Mashallah.
So very privileged and proud of that. And I think the big message is to be sensitive to the couples who are unable to get pregnant, and for the couples who are having difficulty, to not be afraid, and to seek the advice and to seek a consultation. And I think with COVID now, like you said, to start a topic, lots of COVID out there. So we do a lot of telemedicine. So those appointments are available to be able to connect through telemedicine, submit all your records, have those reviewed, have a telemedicine appointment, and then kind of pick up from there.
And then keep on praying as well. So thank you very much,
Yes,
Dr. Saab, for
thank
being
you.
with us. It was lovely to be in conversation with somebody who's spreading happiness, who's sharing happiness with a lot of people as well. And thank you very much for bringing the latest technology down to Pakistan as well.
And I feel like we still have a lot of questions, but I'm sure if you guys still do, you can contact Dr. Saab. You know well where to find him as well, and you will get all your answers too. But Shazad, for all the couples that have been trying for so long, and unfortunately for whatever reason or for God's will, they are still not able to conceive because of the family pressure, and because of the societal pressure, and because of probably the relationship pressure as well. They do get into a massive psychological, I want to say it gets them into anxiety, massive anxiety. I don't know how they even sort of fight it or get out of it.
Exactly.
And if it starts to get to your mind or your head, that in turn again sort of alters your performance, right?
Yeah.
And I think it's a cycle which goes on. So in the next segment, let's talk about how to actually come out of such a psychological trauma.
Exactly, because not just that, ladies and gentlemen, for all of those kids who were born with
Yes.
amidst COVID as well, they tend to be very shy, and they tend to
Quarantine
be very
babies.
antisocial as well, the quarantine babies. So we'll be talking about that in the next segment. Don't go anywhere. We'll be right back. This is your one window solution to having babies. Good morning.
Okay, good morning. Welcome back to Well This Morning, ladies and gentlemen. Like Shazad Khan said, your one-window solution to, well, everything.
Yeah.
But for today, we are trying to sort of develop the conversation around infertility, how it prevails in Pakistan, and what sort of symptoms it can cause, even afterwards and even before the treatment as well. But the link
But
that
there's postpartum depression as well.
Of course, that is definitely one major thing. And when we talk about depression or anxiety in general, it is something I feel like, Shazad, right now at this point in time, everyone is facing, and I have said this before as well. We are in the second greatest depression altogether. We've seen this one in the last century globally as well, but this is happening again. Every person I talk to, be them, I mean, teenager, a grown-up, or even grandparents for that matter, they are going through something hard. So from my personal analysis, I feel like it is because of the pandemic as well.
All right.
But where you said there are babies born in the pandemic in the past 2 years, and because of the quarantine or the lockdown, those poor kids did not see the outside world. The maximum that they did see was something from outside the window. So for them, it's still a screen and things happening behind the screen, right? Exactly. And now when they're meeting their family members and, well, trying to make friends, they're so shy in their personality. It actually gives me a massive concern about them having complexes or social issues, you know?
Exactly, and not just that, you know, so I can relate with it, and it's because of the fact that my youngest daughter, she actually happens to be, alhamdulillah,
a quarantine, yes.
Almost
I
around
remember now.
1 year and 5 months or 4 months, ladies and gentlemen. And earlier, you know, when we used to go away for drives, because obviously there was nothing else to do amidst the lockdowns and pandemic and quarantine as well. So, you know, she would just stare out of the windows. And I was lucky enough that, alhamdulillah, that, you know, my sister was living with us at that time. So she kind of had this relationship with her. But she won't actually go to anybody else. And she would just stay with me or with her mother or, you know, with her puppo. You know, that's pretty much about it as well. But then half of the time, due to this stress and anxiety, ladies and gentlemen, this is one of the reasons, as doctors once have said, that people, they have difficulty in conceiving a baby as well. So we're lucky that we've actually have been joined by a psychiatrist over here in the studios with us. She happens to be Dr. Beena. Hello, ma'am. Assalamu alaikum. Good morning. How are you?
Wa alaikum assalam. Thank you so much for inviting me and giving me this opportunity that I talk to people and have an awareness program in a way that people should know how they feel and to what extent, if they feel so bad and so unwell, how to seek help. Where is that threshold? And you rightly said, Dr. Saab spoke about infertility. I'm going to talk a bit more about its effects and after effects.
Please.
So to begin with, I mean, I have come across some friends, colleagues and cousins who get married and then they get worried that it's just 1 year that has passed to marriage. And they already start worrying because in our culture, grandparents as well as kab la rahe ho. Exactly, and that anxiety builds up and they start expecting, and what they do not know is that stress can affect. I mean, it's a factor, it's not just a cause. There's so many other causes that can lead to infertility, but I'm talking about stress as a factor.
Okay.
And there are gynecologists who do point out that you better deal with your stress, your depression or anxiety first, and then come back to us.
Okay.
So yeah, it's a very important factor.
Right. So just to sort of not confuse you anymore, the signs we're doing, it's for us. You know, we're fighting to take our turns.
We actually have a
Ignore
secret
Sign
non-verbal language, you know, and we use it to kind of not interfere in each other's way.
Right.
That's what
So where you said that, you know, even gynecologists now are sort of suggesting people to deal with their anxiety first. Just recently, I had to go to a gastroenterologist. I'm having massive issues for so many months now. And I felt like it was a stomach issue because it is, right?
Because you were throwing up, right?
Continuously, I can't eat anything. So I went to this gastroenterologist and he listened to me very carefully and he did, you know, sort of did, for about 12 tests I got done, everything. And you know what he prescribed me? He goes like, you need to go to a psychiatrist. And that was his prescription. I was like, my tummy really hurts. Can you do something for me? He was like, it's not your tummy.
And here comes the stigma, isn't it? The stigma of going to a psychiatrist.
You know,
is the
I
first
wouldn't mind,
hurdle.
but I never
So
thought
what we
of
did
it.
was we invited a psychiatrist.
Yeah,
Huh?
now I'm giving a free consult.
By the way, the stigma is not just in Pakistan, it's all over the world. It's with UK people, it's people who are educated, who speak English and other languages and who have discovered the medications themselves.
Okay.
We're talking about that population. They also have fear of going to the psychiatrist.
Yeah.
So, well, you have projected quite a lot of patients who go to gastroenterologists
Right.
and who also go to cardiologists and who go to
Right.
neurologists as well. If a neurologist, gastroenterologist, and another specialty doctor writes a psychiatry medication, they are okay and happy as long as they're not told. They would take it. But the moment they are told, you go, better go to a psychiatrist, they become hesitant. Oh, main pagal to nahi hu. I'm not crazy. Why has he referred me to the doctor? And that is where the hurdle and the difficulties start, complications start, because seeking help, delayed help would obviously mean a lot. I mean, you have to take the burden, not just the medication itself would be at a higher dose, but the duration would be prolonged.
Exactly. And, we certainly have examples, a stitch in time, ladies and gentlemen, saves nines as well. But there's one more thing now. Okay, I'm going to change the topic a little bit because, talking about our generation, unfortunately, we have seen that obviously, our parents were busy kind of making sure that they have a safe future for their kids. And, they've used to work hard and whatnot. But we people, fortunately, alhamdulillah, have alhamdulillah, access to everything pretty much over here in life, and we live a very healthy life, and we're thankful to Allah Almighty. But just because of this, just because of having this ease of having everything, at a click of our hand, I've seen that a lot of couples now these days are addicted to drugs. And unfortunately, I have to bring it up as well. And,
No, it's good.
And people are having difficulty in kind of tapering it down. And I know certain people where they went to a psychiatrist, and so what they would do is that, obviously the doctors have already told them that you can OD, the impacts being on your organs as well, and that God forbid you can have a heart attack. So no matter what happens, but the addiction gets so strong that while they're actually are on the medication which has been prescribed by the psychiatrist, everything's fine. But then one day they feel so good about themselves that they actually want to go back to it. Do we have a permanent solution to these addictions, or to fathers who are addicted, or to mothers who are addicted as well? Because just very recently I came across a case where this lady was pregnant, but she was still doing some drugs as well. So don't you think that, we're actually putting in danger that baby's life as well? So what permanent solution do we have for these people?
Well, it's more like, let's not talk about permanent solution and temporary solution. There is a solution.
Okay.
What happens is, like, for example, a patient who's diagnosed with diabetes, we have this understanding this patient is going to take medications forever, isn't it?
Okay.
For example, a patient has cardiac problems, would take the medication
or blood
forever.
pressure for that reason.
With psychiatry comes 1/3 rule, and that's what, people have their own ideas that agar chale gaye to sari umar loge. Well, that's not the case. First thing, you need to be clear about that. 1/3 rule means you have an illness, you did not have the illness before, you were diagnosed with it, you continue the medication for a shorter period of time, and then the psychiatrist should encourage the patient to come and wean off the medications. 1/3 rule. The second 2/3 is he stopped the medication, but he has a relapse. Obviously, he would be put back.
Okay.
The last 1/3 are those who have difficulty stopping medication. Every time they stop it, they have relapses. So there are 1/3 people who do come in that domain.
So there are different types of things, and obviously, because of how learned and now experienced you are able to sort of identify and then treat them accordingly as well. But since we're short on time, I feel like we're all over the place in a way that we need to talk about so much. So I'm going to try to bring the conversation back to when we were talking about the social anxiety of quarantine babies. What do you think is the psyche behind it? Because parents have written to me literally to talk about it. They're worried of their 1.5 or 2-year-old because they're not social.
Well, they don't have to worry much unless the baby or the kid, the toddler, is less than 3 years of age, because they do not carry the memory of how stressful the life would be.
Okay.
It's all subjective and objective as well. What is stress? A stress for a mother may not be a stress for the baby, because babies are projection of their being unwell through their behavior, isn't it? When they are not behaving well, it's the mother and the father who needs to do change rather than the kid or the baby.
Interesting. I
And
don't
if
think
a
people
baby
think
is
like
born
that.
in quarantine, how would the baby know what is freedom? I mean, there is a freedom, some freedom at
course.
home. In a single room, there are people, look back to our culture and the villagers, how they spend life in one room, and there's so many. So it's not a cause, it's a myth, it's I think our misconceptions.
Really?
Yes, it is.
Oh, interesting.
And since you've actually got it covered as well, so I want to move on to another chapter where I've seen people who've actually been diagnosed with depression and they're on medication as well. But you know, they have their own triggers. I don't know what those triggers are as well. But what I've seen in most of the common cases is that the person who's actually going through depression, they start to blackmail their families as well, maybe for money, maybe for any materialistic return.
Some of them.
And then they kind of say that, okay, you know, if you're not going to give this to me, I'm just going to kill myself. What can we do to kind of make sure that all of those parents are at ease and that they wouldn't worry about that particular person who's threatening them almost every single day that, hey, you know what, I'm just going to kill myself?
So let me
God
split
forbid.
your question into two
Yeah, sure.
bits. The first thing is depression,
Obviously.
depressed patients. The other is the malingerers.
Yeah.
Malingerers are very few. They're more so in the army and those who go out and fight these wars. And yeah, it's more common in females as compared to males.
Exactly.
Depression is the feeling of feeling, it's a feeling, you feel low. It's wo udasi that you feel for a little period of time that is prevailing, persistent for more than 2 weeks. You feel it every day to the extent that you can have crying spells. You can have, I mean, this is plus minus, not
All right.
everybody can have it.
Okay.
But you feel low as well as lethargic, tired. You don't feel like getting up and doing, for example, having a cup of tea is such a difficult thing to put tea in it and then have it. By the way, they don't feel like eating as well, and they don't feel like talking as well. And they have these negative thoughts, which some of them identify as overthinking. Once they start thinking about it, all day passes by. If a friend or relative or family member comments, "Ye kya kar diya?" For example,
Okay.
their mind would start thinking about it and would go to extreme levels.
Or on a
Okay,
guilt
why
trip
did he or
even.
she said that, or things
Right.
like that, self-blame, guilt, and all that. And it comes to an extent that it affects their life. Not just if it's a mother, she would not be able to look after kids. If it is a man who's going out for job, would not
be
enjoy it, would have poor performance. A driver, for example, may be so distracted that he is at risk of accidents.
Oh God.
Such people, if they are young, can go to drugs. The first question you asked, and drugs, you are right, is very common.
Yeah.
And which drugs? Nowadays, ice is so easily accessible, cannabis, and there are so many others.
Different opioids. Everything is here.
So there are a number of factors. It's the social circle also that we are, you know,
A part
spending
of,
life
yeah.
in. There were times when they were not accessible.
पता ही नहीं होता था.
पता ही नहीं होता था कहाँ पे मिल रही, कहाँ से नहीं मिल. Now I've heard online
Dark
delivery
web, yeah.
Students
also.
are dealing
Is
at
it?
their schools,
Yes.
man.
Yeah, that's right. It's also easily accessible in schools. So, for example, peer pressure at 12 or 13 or 14, who has poor ability to make decisions and is
Right.
all in all about my friend and he told me and he's nice and all and this is cool,
Right.
and that you will feel okay. May take it once, experience that high,
Yeah.
and that high
Gone.
releases a chemical called dopamine.
Yeah.
And that dopamine is a strong reward system. So what happens? He keeps on taking it every time he feels stress. And so when he starts taking it every time, they develop there's a word for it, it's called tolerance.
Okay.
That if loses its effect, he has to take a higher dose for that. And so he is stuck in that cycle of taking it again and again till it affects his academics and so many other aspects of life.
So then, you know, coming down to where people who actually suffer from depression have started to blackmail their parents or the family around them.
Yeah.
So how they do it is the suicidal ideation, expressing it. If you do not do this, I may end my life.
Yeah.
If you do not. So let me tell you how we do assessment. There is a personality trait called borderline personality
Right.
Yeah, yeah.
disorder.
Right. Yes.
Some females can have those traits. Some people can be very impulsive. For example, you did not listen to me and you have not been listening, and so I'm going and jumping off the cliff. If I keep on saying this again, and I have personality which is impulsive, and I keep on, I mean, there is a pattern that the parents or family members would know that this guy is very unpredictable.
Right.
It's very unlikely that person would do. By the way, you should anyway seek help from a psychiatrist. This is just a general impression I'm giving.
Yeah.
Okay.
But then if it is a man who is around 40 and has had stressful life events and says, I'm feeling so down and I have these thoughts, you have to better take it very seriously. Don't say, Peer ke paas jao, dam ke paas jao, darood ke paas jao, dam darood ke paas jao. You better take him to a psychiatrist and he should seek help but he will get better, inshallah.
And one last thing, you know,
Yeah.
I know, Shiza, that you actually wanted to ask something as well, but, you know, with this Zahir Jaffer case,
God.
there's a realization which I've come to, and that is that, unfortunately, even a person, a guy or a girl, it does not really matter, is not
so
safe with a
disturbing.
person who's actually depressed even as well. So imagine if somebody's saying that I'm going to take my life or I'm going to end my life, can actually take somebody else's life as well.
Exactly.
Can that happen?
Exactly, and this is an opportunity for me to raise awareness about drugs themselves increase the risk of violence 2 times.
Oh.
If a person is not mentally unwell but is taking drugs, it's very, I mean, the first thing we do is risk assessment.
Okay.
Is this person violent? Is this person losing temper? Is he losing temper very often?
Okay.
The problem is when they take drugs, that is in intoxication state, they feel elated, they feel like they can do anything, and they feel like, and if they are confronted with, they can have an emotional outburst, which can go
Right.
to rage and physical violence. When they feel down, they're even worse. They're craving for the medication. They're so irritable in both ways, and hence the research says if the population is not taking anything, the risk of violence related to mental problems is not as much as it is misconcepted in society. But if the person is taking drugs with no mental problems, the risk of violence is high.
Or even doubled for that matter.
Doubled for that.
And
That's
thank you
thank you
very
so
much for
much for-
saying that. And I
yeah.
want people to understand it this way as well, that you really need to be there for people, but you need to maintain safe distance as well.
Absolutely, and I feel like, you know, when someone is so close to you or when you really care about someone, you sort of tend to be blinded by the red flags. So I really, really wish and hope that you are able to identify the red flags for the sake of them, because you want them to improve. And for all the people who sort of self-actualize that, all right, the drugs that I'm doing are actually, you know, just the dopamine that's making me happy. There are other ways to release your dopamine. Please try to do that. The effect is going to be
Exactly.
the same, I promise you.
Make sure that you go out, ride a motorbike, probably
I mean,
go
work
trekking,
out,
you know,
go
do something,
play.
go work out, yeah, because the very moment you're actually going to lift like 100 kgs on your bench press, ladies and gentlemen, you won't be remembering anything other than that as
And
well.
if I do a successful, you know, spine twist during my yoga, I feel so powerful. I'm like, yay, I achieved
Fine
something.
twist. Well, but ladies and gentlemen, obviously, you know, we hope that, you know, we kind of played our role in making sure that the society or the place we live in is going to be a better place tomorrow, inshallah. We're going to have a special transmission on the 6th of September. Please make sure to tune in at 11 a.m. in the morning on Monday as well. But for now, we are actually going to say goodbye to everybody who's out there as well. Please make sure that you write to us. 1, 2, 3.
Good morning.
morning.
Take